Today we are covering cancer, focusing on how the NCLEX tests your ability to prioritize care for oncology patients. The exam will not ask you to diagnose cancer, but it will expect you to understand the difference between staging and grading. Staging, often using the TNM system for tumor, nodes, and metastasis, tells you about the physical size and spread of the cancer. A high stage, like stage 4, implies metastasis, shifting care priorities often towards palliative and comfort measures. Grading, on the other hand, describes how abnormal the cells look under a microscope. A higher grade means the cells are less differentiated and typically more aggressive. Let's move to treatment modalities, starting with chemotherapy. The NCLEX loves to test you on managing its systemic side effects. The most critical one is bone marrow suppression, which leads to neutropenia, anemia, and thrombocytopenia. An exam question might describe a patient on chemotherapy with a low-grade fever of 100.5 degrees Fahrenheit and an absolute neutrophil count, or ANC, of 450. This is a neutropenic fever and a medical emergency. Your immediate priority is to initiate infection control protocols, obtain blood cultures, and prepare to administer broad-spectrum antibiotics. Do not choose to simply administer an antipyretic. The priority is addressing the overwhelming risk of sepsis. Now consider radiation therapy. Unlike chemotherapy, radiation's effects are typically localized to the treatment area. The exam will test your knowledge of managing side effects like skin reactions, officially known as radiation dermatitis, and fatigue. A common trap is selecting an answer that suggests using an oil-based lotion or scrubbing the area. The correct nursing action is to advise the patient to gently cleanse the skin with mild soap and lukewarm water. Pat it dry, and use only a water-based lotion approved by the oncologist. Also, energy conservation strategies are key for managing the profound fatigue associated with radiation treatment. Oncologic emergencies are a high-yield topic. One of the most tested is Tumor Lysis Syndrome, or TLS. This occurs when a large number of cancer cells die rapidly, releasing their intracellular contents into the bloodstream. It's most common in patients with bulky tumors like lymphomas or leukemias shortly after starting chemotherapy. The NCLEX will test your ability to recognize the distinct metabolic changes. A helpful mnemonic to remember the electrolyte shifts in TLS is PUNCH. This stands for phosphate is up, uric acid is up, sodium is down, calcium is down, and H, representing hyperkalemia or potassium, is up. The most life-threatening of these is hyperkalemia due to its risk for cardiac dysrhythmias. Therefore, a priority nursing intervention for a patient at risk for TLS is monitoring cardiac rhythm and electrolytes, in addition to providing aggressive intravenous hydration to help flush the excess electrolytes and uric acid through the kidneys. Finally, let's consider immunotherapy. This modality stimulates the patient's own immune system to fight the cancer. The exam might present a scenario where a patient receiving an agent like pembrolizumab develops a fever, chills, and body aches. Your role is to recognize these as common flu-like symptoms, which are an expected side effect of the immune system being activated. While you would still assess and report these findings, initial management often involves supportive care with hydration and antipyretics, differentiating it from the emergency response required for neutropenic fever. Across all scenarios, the core nursing skill tested is your ability to assess the situation, identify the most immediate life-threatening risk, and prioritize your actions to ensure patient safety.